here we are with my good buddy, Dr. David Hepburn, and I've got a list of questions that the staff and I at the Cannabis Buyers Club here in Victoria are throwing out. Next on the list is about CBD and dementia, and some of the other, kind of problems like Parkinson's that develop later on in life that many of us fear happening. So how is it that CBD can help with those issues?
Well, dementia is a very interesting area of research, of course. The actual mechanisms of dementia have not yet even been determined how it happens. But there are smoking guns, as they say. The smoking gun is a couple of things. One is this intracellular beta amyloid, this deposit that's made inside the neuron. And normally, right now, we're all making these beta amyloid complexes and we're depositing them in our, as kind of a gunky neurofibrillatory tangle inside our neurons. That's happening, and that's destructive to that cell. However, we clear it out. Normally speaking, we clear it out. With dementia, you stop clearing out those plaques, those neurofibrillatory plaques. And as a result, they begin to accumulate. It's felt that that certainly plays a role in the fact that it causes inflammation. Now, keep in mind that dementia is inflammation. Neuroinflammation is neurodegenerative conditions. So inflammation is a bad thing. So how does cannabis, now you mentioned CBD, but the most interesting research of late was that THC was actually was effective in small doses. They took some mice that were older mice, different ages, and then they took younger mice. And they gave all three groups THC, and then put them through this memory, these mazes, and this other sort of cognitive things, whatever mice do for cognition. And they discovered that by giving the older mice the THC, it was able to allow them to operate on the same level as a younger mouse prior to taking the THC. Now, when they gave the younger mouse THC, it did worse. As you can imagine, they got kind of stoned. But for older mice, it actually creates a system that makes the cognition work better. It reverses that, which is why it's so interesting that cannabinoids work differently for different people at different ages. So you give the same cannabinoid to a 21-year-old, it's could often do the complete different thing than if you gave it to a 71-year-old. So there's quite a variance of reactions based on age, and this is one of the areas. Now, again, dementia is also inflammation. So the smoking guns are something called phosphorylation of tau proteins, hyperphosphorylation. So these tau proteins outside the neuron also get affected. The inside the neuron, the beta amyloid plaques get affected. And cannabis has now been shown to decrease the inflammation. We know that one of the things that cannabis does is it is immunomodulatory. It helps decrease inflammation. Well, it helps to do that. It helps to decrease the inflammation. It helps to remove those plaques from inside the cells. So keep in mind, this is all at research level now. We can't go out and say that it should definitely be used as a supplement to prevent aging, but it is extremely intriguing, the research being done in the areas of dementia, and both CBD and THC, not just the CBD for the inflammation, but also the THC, which has been shown. It was actually a remarkable study that came out on the mice, showing the difference in their abilities. That an older mouse was virtually the same as a young mouse without any THC.
Now, are these, I guess, related to issues, say, typical with aging, like Parkinson's disease or ALS? Are they related at all?
Most of the neurodegenerative conditions, as you mentioned, MS, Parkinson's, ALS, and others, are neurotoxic conditions with inflammation. So anything you can do to mitigate the inflammation. Now, of course, with one of those conditions, like for Parkinson's, there's issues with tremors as well. There's issues with dopamine. And we know that cannabinoids play a role, not directly on dopamine receptors, but indirectly, that actually can affect tremors. And I think that we've all are aware of that extremely remarkable video of the retired police officer with Parkinson's. If you haven't on YouTube, you need to look it up. It's incredible. Who comes and he has had Parkinson's for years, dystonias, and he takes inhalation of cannabis, and within minutes he is able to hear his voice for the first time in years, and he sings, and it's quite a dramatic video. There's actually a few of them. So what's interesting about Parkinson's is because it's a disease of tremors, it's very visible, and you can see remarkable differences rather quickly.
Mm-hmm.
With conditions like dementia, of course, they're long-term, long sort of acting things, and so obviously the research is a lot different there. But it's still very exciting when you realize that we're going towards an area where replacing a diminished endocannabinoid system of aging is becoming more of a very interesting possibility.
Mm-hmm. And for most of these patients, typically it's the oral use of cannabis that we're talking about that they're using.
That's right. They tried to get the mice to smoke them and they just refused because they said if you do that, we're going to be eaten by a snake or something, one of the jewel snakes. No, you're right. They're injected or ingested, yes.
Mm-hmm. And so I would assume that for patients that say have a family history of these types of conditions, that using cannabis in either the early onset or preventatively may be beneficial for them?
Wow, and that's a powerful thing, and I'm of two answers. One is the sort of scientific answer, we haven't seen all the tests and evidence and things. The other one is what would I do in a situation like that if I was losing my mind, as I am, of course. As I would consider absolutely the intervention of phytocannabinoids in many conditions. If I were to find out I had a cancer, if I were to find out I had a neurodegenerative condition of some sort, I would certainly not hesitate in most cases to look at the use of cannabinoids as a safe. We know the safety profile is massive on cannabinoids, and whenever we look for medications, we always look for safety, efficacy, tolerability, and cost. Those are the four main things, and we know the safety profile on cannabis is huge, so we're not worried about that. So I would tend to absolutely look at the use of cannabinoids for if I were to come down with an unfortunate condition.
And I guess venturing off into a different issue, we didn't put a question aside for schizophrenia, but that's another concern that people have more in the younger age.
Yeah. Well, let me just say that it's never been shown, cannabis has never been shown to cause schizophrenia. There's no evidence that it has. There have been some studies that have shown that there's twice the incidence of schizophrenia in cannabis use in youth. But there are other studies that say that countries where there is no use of cannabis whatsoever by youth has the exact same incidence as countries where it can be up to 20% use of youth. So there's no change incidence in schizophrenia in countries that have cannabis and don't. So that says a lot right there from an epidemiological point of view. But this has never been shown to cause schizophrenia. There's concerns, however, that it can unmask a schizophrenia. So it's like saying if you had two piles of sticks and one pile you had some embers on, and you put gasoline on one, would do nothing. If you put gasoline on the one with the embers, it may absolutely exacerbate and aggravate that. So again, other than a temporary psychosis that everybody knows well, with, we get stoned, that sort of thing, there has been no proven long-lasting schizophrenia or psychosis that's been caused by cannabis at this stage.
And certainly, I would assume likewise with the other issues that we were talking about with, dementia and Parkinson's and stuff, that cannabis and cannabinoids wouldn't be a contributing factor to the onset of any of those conditions.
Never heard of any of that. No.
Yeah. Okay.
Yeah.
Just want to be clear.
No, great.
So.